Kidney cancer is the third most common urological cancer, following prostate and bladder cancer. It primarily affects elderly individuals, with a peak incidence between 16 and 17 years old. Although it is relatively rare, accounting for about 3% of all cancers, it is characterized by resistance to radiotherapy and chemotherapy, making its treatment more specific. This cancer is often discovered incidentally during imaging examinations. It has a male predominance, with a male-female ratio of 3:1, especially after the age of 50. Renal cell carcinoma, or RCC, makes up approximately 90% of malignant kidney tumors. This cancer, and due to the deep location of the kidneys, remains clinically silent for a long time. This results in a slow progression with late infiltration, with hematuria or blood in the urine being the primary symptom. The gold standard for diagnosis is CT urogram, while the primary treatment remains radical nephrectomy. There are so many histological types of kidney cancers. Clear cell carcinoma is the most common type of kidney cancer, accounting for approximately 85% of cases. It is usually located at the periphery of the kidney. While most cases of this cancer are sporadic, some familial forms exist, particularly in younger patients, where tumors are often multiple and bilateral, meaning they exist in both kidneys. This carcinoma originates from the proximal convoluted tube of the nephron and is characterized by the proliferation of clear cells. This tumor is generally round, well-defined, yellow-tan in color, and often contains areas of necrosis and hemorrhage. Second type is tubulopapillary carcinoma. This is a less common type, accounting for about 50% of cases. It arises from a distal convoluted tube. Compared to clear cell carcinoma, it has slightly different biological behavior, although its clinical feature may overlap with other types. The third type is chromophobe carcinoma, which is a rare subtype representing around 5% of kidney cancers. This chromophobe carcinoma originates from intercalated B cells of the collecting duct. Among all kidney cancers, this one has the best prognosis. The fourth type, biliary duct carcinoma. This is an extremely rare cancer, account for less than 1% of cases. It arises from the biliary collecting ducts, which are located in the renal medulla. Unfortunately, it is highly aggressive and associated with a very poor prognosis. And finally, sarcomatoid carcinoma. This is a malignant transformation that can occur in any of the previous histological types. While not a distinct type, it represents an aggressive form derived from other kidney carcinomas and is linked to an especially poor prognosis. We will talk about positive diagnosis, clinical symptoms, and clinical examination and treatment and other stuff in the following videos. Thank you so much for watching until the end, and I hope these informations were helpful to you. I'll see you in the next one. Goodbye.